Jane McIlraith, Adult Safeguarding Nurse.
Terri Banks, I'm Head of Safeguarding for Children and Adults for Manx Care.
The training is delivered by Safe Lives organisation, who are based in the UK. It's done via 4 modules from finishing May, completed in September, and it's delivered online. There's placements to do, as in like trying to attend a court process, seeing the Sexual Assault Referral Centre, and seeing a risk assessment conference. And there's online studying, worksheets and coursework to do as well. It's if you're approached with someone that's made a disclosure about domestic abuse, it's how to manage that. So from the assessment process and the ongoing management in the future, I'll have a caseload that I'll follow up any adults of. An adult came into emergency department, made a disclosure. It's knowing how to hold those concerns and how to go ahead.
And why was it something that you wanted to do?
It's been identified in the adult safeguarding nursing team that we've had an increase in domestic abuse referrals, and a specialist post was identified that we did have concerns, especially with adults attending emergency department. We do meet adults that have made disclosures, but obviously it's to give extra support as well, and it's been part of my safeguarding role for a lot of years, but especially now in adult safeguarding.
And was it May you said that the training will be complete?
Yes, and then the final coursework in September.
And then I presume from that point onwards you'll be fully trained and able to perform these duties?
Yes, that's correct.
And so Terri, if I come to you then, so do you want to tell me a bit about why this role was identified as being needed?
Yeah, so IDVAs have been present in all hospitals in the UK for many years, and having come from the UK 2.5 years ago and managed a service very similar to this, I've seen the actual impact that they can have on victims of domestic abuse. So the Domestic Abuse Act was invoked on the Isle of Man on the 4th of January 2023, and now we've got that legal framework and the protection for victims. So I was really, really wanted an IDVA impost. We've had to be quite savvy, for want of a better word, because an individualised IDVA on their own is a lot of money, and obviously we're looking at resources. So what we did was think, right, we've got Jane, who's seen the victims anyway, so we've added that qualification that she will get onto her current post as a safeguarding nurse. So it's a very, very difficult process for Jane to get through. They're looking at thousands of applications. So we're really proud she'll be the first Manx Care accredited IDVA. So since the Domestic Abuse Act was invoked, Jane has been going down every day, and we've encouraged staff. We've had lots of training for all members of the health team, including community, ED staff. So we've had Safer Lives, who are the bespoke trainers for domestic abuse nationwide. They've come in and done training for all staff, and we've implemented what we call routine inquiry. So any patient that comes in, rather than saying, it's all about words, rather than say, what's happened to you, we would say, who's done this to you? We get a reachable moment. What we see is a lot of the patients present with mental health concerns, drug and or alcohol. We see bruising, we see marks. We don't always see that, because you've got to understand there's a coercion and control element to domestic abuse, which is also in our Domestic Abuse Act. So it's that reachable moment for the person. ED will phone up, Jane will go down and ask the person that question, who is harming you and what can we do?
And I suppose that's the thing with victims of domestic violence and domestic abuse in general, is that it's not as clear-cut to be able to identify victims or even to have them admit it to you. That in itself is a massive step. So how do you break through that wall within your role?
It's having the knowledge and experience and professional curiosity. So, for example, if somebody came in, there might not be any signs of any physical or mental harm, but if their phone is ringing constantly, or the shaking when the husband appears, we're looking for those subtle signs, and that alerts us as professionals to start asking the questions without the alleged perpetrator to be in there. And just bearing in mind, we're not always talking about women. We have males through the department as well that are victims of domestic abuse, and then we've got to use the think family approach and think about what are the children witnessing and how are they suffering in this house. We've had some disclosures of some very elderly residents on the island that have been suffering domestic abuse for over 30 years, And statistically, and this is a national statistic, a person is assaulted or spoken to in or financially abused, because it's not always physical, it's financial, mental, at least 35 times before they seek help. So we want to create this safe space, in particularly within D, but with ED department, but we've got to think about our maternity services, our sexual health services, our district nurses, and Jane will be that person. And what my hope is, again in the future, because it's a very difficult course that Jane's doing, it's at least 300 hours on top of her day job. I can't take that pressure away from Jane, is that we will start looking at staff victims of domestic abuse. So if Jane finishes this training, my hope is that it will be successful and we'll get somebody in then to look at staff, because we know again that nationally, and we employ thousands of staff within Manx Care, that there will be victims of domestic abuse. So that's the next project for me.
Is it difficult to be able to help victims understand that it's not just violence that is a form of domestic abuse? It can be that coercion, that controlling behaviour, and those other sides of the abuse, I suppose. Is it sometimes difficult for victims to understand that they are actually victims, and that's why they don't necessarily come forward?
Yes, because I think historically, everybody's looked at domestic abuse because we've changed the language. It was always domestic violence, so people thought they'd had to be assaulted. So we've now changed that to domestic abuse, and getting somebody to realise that they are being gaslighted, coerced or controlled. It's not an easy process. It's a very slow process, but we don't give up on the victim. We have a checklist that we use, a nationally recognised one from Safer Lives, which asks those difficult questions. Sometimes you'll see the light come on in the victim and think, oh my gosh, love bombing, like when you first meet somebody and they're buying you flowers and you're cancelling dates with your friends, or you're not going out. There's all that excluding you from different friendship groups, ostracising you from your family. It's all those signs that sometimes I don't see, but we know what they are, and it's that education. So Jane could be working with a victim for 3 weeks, and she could be working with some of the victims for up to 6 months, and we'll be supported by victim support and maintain our really good relationships with the police, because it's got to be a multi-agency approach, albeit Jane's doing it from a health perspective.
So what is the picture here on the Isle of Man, and particularly here within Manx Care? How often do you see the need for this resource?
It's a difficult one, that, because we've not really got any statistics, because like I said, we've only just had the Domestic Abuse Act. We know that there'll be hidden victims. There's very rural parts of the Isle of Man, as you know. People don't always come into hospital, they don't always access health services. It's a difficult question to ask, but what we want to do by Jane being in post is raise awareness to say, we're here, we'll listen to you. And again, I know I mentioned statistics a lot, but some adults come in with abdominal pain. That's a very common attendance for younger victims of domestic abuse. We've got to be savvy, not only with Jane, but with the staff as well, to try and recognise it. So we have had an increase. I'm putting that down to hopefully the protection of the legal framework in the Domestic Abuse Act. And now that Jane's in post, I would like to see that staff are asking the right questions, referring to Jane. Jane's going out into the community. And again, with the training that we've done and our colleagues with the police, there's lots of initiatives forthcoming, which I'll be quite happy to talk to you about once we've got those up and running. So I think it'll be really, really successful for us.
And Jane, just to come back to you, how much of a difference do you think that this training is going to be able to make to you, the work that you do, that of your colleagues, and to the wider community?
It's certainly widened my knowledge so far, and I've just started the first module. So I've learned a lot just once I do meet an adult, to learn to complete that risk assessment process that's been discussed, and the further management. Certainly to include it in any training that we're delivering with safeguarding training to all healthcare professionals, and to support adults living in the community. So we have seen that increase in referrals. So hopefully ongoing, I will be auditing cases as well. So we'll look at the categories and the data and collect that for the future. But hopefully it will help adults live safer in the Isle of Man.
And Terri mentioned that there was a selection process to go through for this, and thousands of people applied. So do you feel proud that you're able to be sitting here saying, yes, I'm going to be the one doing this training for Manx Care?
Yes, I'm very proud of the fact that I've been given the opportunity to see in all my years of health. It's been domestic abuse has always been a part of safeguarding in my role, but I'm very pleased.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.